You know, we always talk to members of the medical community today. Dr. Paul Kamitsuka joining us from New Hanover Regional Medical Center, an epidemiologist there. You smell fantastic, by the way. I'm just putting that out there. You know, the serious thing now, again, was talking about weather headlines. News headline, Zika virus has been everywhere. And I was joking with the doctor, how often do you hear this every day? And you said, thankfully, it's not as much as we heard about Ebola, but it's still something people need to know about.
It is, and because it's something you can contract if you travel, particularly to Central America, Caribbean, and parts of South America. It's a mosquito-borne viral illness.
And I know that everything that's being tied with this, what we hear the majority of the time is the microcephaly of women that are pregnant and the birth of these children.
Right. And so, well, the first thing to emphasize is that 80% of people who get Zika have no symptoms at all. Okay, so it's very it's a benign illness in most cases. In terms of the feared potential complication, this has yet to be proven. But what is the case is that in Brazil there was a surge of cases of Zika, and a few months later a surge of cases of this congenital defect with microcephaly. So it's associated. We don't quite yet know for sure that it's causal, although we're treating it as if it is the case, just because the consequences are potentially
And
so
I know we've
serious.
seen the one case here in North Carolina, but again, we want to stress it wasn't born here. This was someone that traveled back to North Carolina.
Exactly.
When you hear something like that as a doctor, do your ears kind of perk up that it's now in our state?
No, because the reality is the likelihood of a lot of transmission here is very, very low. Because the mosquito vectors for spreading Zika virus, the Aedes mosquito, the one that is most involved right now, is not in this area. Now, it's not to say that the local Aedes species may not acquire that, that ability later, but we also have much better ability to do vector control to prevent mosquito populations from exploding. And thereby creating the risk for transmission. So it's mostly the risk for travelers.
And I was going to say, you know, as the months are getting warmer now, you want to be able to treat your home, take care of, and if you have standing water around, make sure you clear that out so the mosquito population is lessened. Doctor, I appreciate the time.
Okay.
Thank you. We're back with more after this.